Hello, my name is Jessica. I'm going to be your student nurse today, and I am here to place a nasogastric tube, otherwise known as an NG tube. I'm just going to wash my hands real quick and get some gloves on. Would you mind confirming your name and date of birth for me, please? Perfect. I'm just going to check that against your wristband. Looks good. And Mr. Jones, do you have any allergies, specifically to foods, medications, or latex? Perfect. No allergies. All right, so as I mentioned, we are going to place an NG tube today. This is being done since you can't swallow safely as a result of your stroke. It can also be for medication administration as well as gastric decompression if we need to get some contents out of your stomach out. So this tube is going to be placed through your nose. It's going to travel down the back of your throat through the esophagus, or the tube that connects your mouth to your stomach, and it's going to end in your stomach. And we would not be able to do this if you had any severe facial trauma, any esophageal obstruction, or trauma there as well. But since we don't have that, we are good to go ahead and place this tube. So the first thing I want you to do is, I'm going to place this first. This is just in case anything comes out while I'm inserting the tube. May it be saliva, vomit, whatever it is, it's okay. This is a basin. If you do need to vomit, this is going to be here for you. I'm going to raise the head of your bed just a little bit. Awesome. And I'm also going to raise the bed to a comfortable working height for me. All right, so before we insert this tube, I am going to check for patency. So I'm going to occlude one of your nares. I'm going to have you blow through that right nostril. Perfect. And we're going to do the other side. Excellent. All right, so it looks like both nares are open. I'm going to insert it on the right, in the right nair. So that's this one right here. First, I'm going to measure the length of the tube that is going to be inserted. So we're going to do that first from the tip of the nose, go all the way to the EAM. Perfect. And then I'm going to measure from there to your xiphoid process. A little bit below that, actually. All right. And I'm going to mark that with a Sharpie so I know exactly how far I am inserting this tube. Okay, so something that's really going to help while we're inserting this tube is I'm going to have you sip some water, because swallowing while inserting is going to make it more comfortable for both you and me. And I'm just going to get some tape here. The tube is going to be taped to your face and secured on your gown, so we can make sure it's not going anywhere. All right, so here is that cup of water for you. We don't have to drink it yet, but when I start inserting is when we're going to start taking small sips of water, okay? All right, I'm going to apply some lubrication to the tube itself, and that's going to help it go down a little easier. It might be uncomfortable. If you do need to take a break, that's totally fine. Please just let me know. And if needed, we can always take it out and start over again. All right, so got my marker here. Go ahead and open your mouth for me. I do want to check one other thing. I have a tongue depressor here. I'm just going to check your gag reflex to make sure. Perfect. All right. Okay, so we're going to start the insertion process. I'm going to have you hold on to your cup of water. All right, go ahead and start taking small sips for me. Perfect. Keep sipping, keep sipping. We're almost there. Got a few more inches to go. Keep sipping, keep sipping. Perfect. All right. It is in where it needs to be. And now I am going to secure this in place with some tape. All right, here's one piece of tape. Here's another, just to make sure it doesn't pull away from the nose. And I'm also going to tape another little section here so it's out of your way. Okay, and last but not least, we are going to secure it to your gown so it does not pull out. But before I do that, I do want to check and make sure it's in the right place. I'm first going to do that by taking some of the gastric contents and checking the pH to make sure that we have it in the correct location in the stomach. So we want to make sure we have a pH of less than 5. Awesome. We have a pH of 4, so it seems like it's in the right spot. And we'll confirm that by getting an x-ray. So x-ray comes in, make sure that the tube is ending in the stomach and not anywhere above or below it. And now I am going to pin the tube to your gown through this piece of tape. Make sure it's not going anywhere. All right. And we are going to hook it up to the low intermittent wall suction. Okay. Put that here and make sure that it's on intermittent vacuum. All right, is that comfortable for you? Okay, sounds good. And I'm just gonna wipe off your chin. We got a little bit of saliva here, but it seems like it went down pretty well. Are you feeling okay? Okay, fantastic. All right, so now we can use this to, like I said, empty any gastric contents from your stomach, help you eat safely, as well as any medication administration if we need that. And I'm going to document in your chart that it is in your right nair and that we are using the 16 FR size. Patient tolerated the procedure well, no vomiting present. And let's see, we did confirm that it is in the right spot, both by checking the pH of the gastric contents as well as the x-ray. So, is there anything else I can do for you? Do you have any questions? Perfect. It looks like the head of your bed is currently at 47 degrees. I am going to raise it just a little bit more so we can make sure you don't aspirate or choke. And I'm going to lower the bed back down. Looks like the bed brakes are on. And we have at least 2 side rails up. Here is your call button. Please press that if you need anything or you feel you need to get up or if you're uncomfortable from the tube. We'll do our best to make you comfortable. I should be back in about 30 minutes to check on you, but of course, if you need something before then, please make sure you hit the call button instead of getting up yourself. I'm gonna put this up just as an extra precaution. Double checking the bed brakes. Is there anything I can get you, any personal belongings you need before I go? Perfect. No. All right. And do you need to go to the bathroom? All right. Sounds good. Thank you so much, Mr. Jones. I appreciate it. You are a great patient. Just going to toss these gloves and do hand hygiene, and I will be back in about 30 minutes. Thank you.